Welcome to the Revita Health and Wellness Show. I'm your host, Francine Marie, and today Dr. Peter Fatinos is here, and we're going to talk about hair loss, female hair loss. Wow, this is I can definitely tell you it's a very deep subject, Doc, because it affects women so dramatically.
Yes. I see it a lot in the women that come in my group, the age group that come to my clinic, 30s, and 40s, and 50s and stuff, and it's either accelerated hair loss or they notice that their hair start breaking. That's a lot of the stuff that I see coming to my clinic. It's another very common reason, and to be honest with you, sometimes we'll kind of unmask a point where somebody may have an accelerated hair loss while they are on the program, and we just got to figure out what's going on with that.
Okay, because there's different, we think, well, that's just a little breakage. And when we go to the salons, they'll say, oh, it's just a phase. Oh, you must be going through menopause. Oh, is it hereditary? Or, or it must be the products. It must be the perm. It must be the color. But if we come to you, you're going to get to the bottom line and tell us exactly what's going on.
Yeah, and we're going to see what type of hair loss it is. There's several different types of hair loss. There's, again, like I said, breakage. You notice your hair is breaking, or you'll notice that you're kind of seeing an increase in diffuse loss of hair. That's kind of an increase in the cycle of hair loss. There's also clumps. I have women coming in saying they have clumps, and patches, where they're noticing. Clumps is when you can kind of feel it and pull it out when they're taking a shower or something like that. Patches is where they start noticing patches of hair loss. It could be at the root, or it could be, like I said, when the hair starts breaking. So there's multiple causes for hair loss. So,
wow.
Some of which are related for women, especially premenopausal and perimenopausal, it's going to end up being one of two hormones. It's going to 99% of the time it's going to be either thyroid, not enough thyroid typically, or it's going to be testosterone. Now, postmenopausal women are not making enough testosterone, so it's rarely going to be testosterone. It's always going to be thyroid, and usually it's not. We don't have enough thyroid, because as you get older, your hormones start dropping off. Okay, so that's the main. Now there are some other types. We do kind of look at those. If it's something that's out of my wheelhouse that I can't really deal with, I'll send a specialist. So there's the autoimmune ones. That means your own body's attacking your hair. There's some kind of things like lupus and some other autoimmune disorders that can cause that. There's anemias. Some of the people who get anemia can cause hair issues. So there are other things, and I do see if that's an issue, and we kind of fix that to make sure that that's not what's causing the hair loss. But for most women that come to my clinic, pre and post menopausal and perimenopausal, which is during menopause, is usually going to be thyroid and less likely to be testosterone.
Is it always in the middle of the head? Is it always on the side? It depends on the person.
It depends on what it is, too. So if a woman comes in and says to me, hey, I'm getting breakage in my hair, it could be anywhere on the head. If they're noticing, hey, I'm losing more hair than usual, then that's pretty much diffusely over the body. If they can have clumps here and there, that could be patches where you see opening of the hair. You can see the scalp and stuff. So.
And then